I get asked a lot of questions about the board certified medication therapy management exam. So I wanted to break down some information about what it is and that type of thing. Also, obviously, give you some tips and pointers regarding kind of preparing for this exam and what to expect, because there has been some changes over the last year or two here. With regards to the content outline and some of the content that's covered. And obviously our study materials at meded101.com, will certainly reflect any changes of late as well as going forward as we update content on an annual basis there. So let's give you a breakdown of this exam and this certification. So first off, just a little bit of background. Is board certification for pharmacists important? It's getting to be more and more important. And what I tell people, it isn't necessarily that you'll get a job that you want because you have board certification, because it is growing in popularity. So many pharmacists has it, but it's more so a reason to exclude you from the interview process. If you don't have board certification in a specific area that you're looking for, obviously we're talking about MTM today here. If you don't have that board certification or potentially ambulatory care certification, that's a good reason that employers can easily kind of weed you out if there's 5, 10, 15 plus applicants for a position, which I have seen and heard of recently here. So really an important aspect in an application if you're looking to get into a more clinical MTM type role. And of note, I think as we continue to slowly make progress on provider status and on expanding the scope of what we do as pharmacists with regards to medication therapy, there are states that are being more and more progressive. And a good way for states, or an easy way for states to prove that you are competent, is to require that you have passed one of these certification exams and obviously have the credential or certification. So it's a good way that for kind of the higher level clinical roles, it's a good way for states to kind of determine, like, yes, you are a competent person and able to provide and obviously potentially bill for, as applicable, bill for certain things that we can do as a pharmacist, obviously there. So this is just from the National Board of Medication Therapy Management website, saying how employers have certainly mentioned in surveys that they would much rather have an experienced pharmacist who possesses skills. And one way to, kind of demonstrate those skills and that competency is to obtain board certification. And I just wanted to prove it to you. I went and looked through job postings related to MTM, clinical pharmacy, that type of thing. And, these are just some examples, obviously based upon what's, the position is about. More and more are either recommending or sometimes even requiring board certification to be able to apply, or at least putting that in their description of their job posting. So again, it's going to become more and more important. I do tell people it's easier to get it shortly after school than it is later on, but certainly I've seen and had a lot of successful candidates go through the process and pass the exam that are 20, 30 plus years from their graduation date. So definitely a lot of things that you got to catch up on. But passing these exams is typically easier the sooner after school you take them. You're used to taking exams, you're used to passing exams, and your clinical knowledge, the expanse of your clinical knowledge, is probably better at that time versus 30 years later and you've worked in a specific setting for a while. Obviously there's things that you've let lapse that may show up on the exam that maybe you don't have that much experience in. So my recommendation, take it sooner rather than later, which I know can sometimes be challenging as far as the financial state of things when you're younger as well. Okay, one last kind of breakdown. I get asked this quite a bit through emails and that type of thing. What is the difference between a certificate and a certification? So a certificate is basically proof that you did a training program or you took some CE, that type of thing. And typically board certification is a much more rigorous process, and you actually have to prove that competency through an exam. So again, you can get a certificate, which is nice, and some employers will be happy to see that and that type of thing. But really, board certification is a much more formal process and a much more in-depth process as well, typically for preparing for these exams. So board certification, again, proves that you have training and experience and are competent within that area. So let's get into a bit more of the details on the BCMTMS exam. So that stands for Board Certified Medication Therapy Management Specialist, and it is basically operated, managed by the National Board of Medication Therapy Management. Eligibility. So this is always a good question I get. I would obviously refer you to the website. At this time, eligibility, at the time of this presentation, eligibility, obviously you got to be a pharmacist. They're generally recommending 2 years of experience. Experience criteria can be waived if an MTM approved training program is completed. So that's like APHA and those type of things. Those programs can be classified as your experience, basically, to be able to take this exam. So it generally tends to be a little bit more lenient on the eligibility compared to some of the Board of Pharmaceutical Specialties, or Board of Pharmacy Specialties exams, such as BCPS and BCACP and that type of thing. There are obviously other ways to get that experience. If you've done an MTM residency, obviously that's a situation where you'll be eligible there. You got to fill out the application, and obviously, unfortunately, have to pay a fee as well. If you don't pass the first time, which definitely happens from time to time, that retest fee is $200. One thing that I remind folks not to be shy about is with your employer. I know I've had this happen in the past where employers have foot the bill for study materials as well as that exam fee. Okay, so you're doing something to try to make yourself better, make yourself a better employee, obviously be able to help patients, and obviously help the institution that you're working for, company that you're working for. So employers a lot of times will be receptive to helping you pay to essentially become a better pharmacist. So really important, just ask. And I mean, the worst case scenario is they're going to say, no, we don't help with that. And that might tell you a little bit about your employer too. So, and what they value. So again, ask to help with the cost of study materials and the exam itself. It's a no-brainer, and I've definitely had a lot of candidates come back and say thanks, for recommending that I do that, because they got the whole thing covered, and it pretty much only costs them their time essentially to go do it. So the exam itself, so there's the link to the content outline. You've got to look at the content outline for these exams, and obviously specifically here, the BCMTMS exam. It has changed recently. Like I said, about a year and a half ago now, pharmacogenomics was added into the content outline, as well as pharmacotherapy, that aspect, that portion of the content outline, expanded dramatically. Okay, so if prior to this change, we probably had 10 to 12 hours of content in videos, that type of thing, that covered the content outline. We have now expanded that, and we're in the ballpark of 15, 20 hours plus of video content. We've expanded questions. We've probably added 300 to 500 questions within the last year or two here. So this content outline has expanded dramatically. So this is definitely going to be a much more expansive and obviously difficult to prepare for if you've got to prepare for more topics. So can't encourage you enough to go through that content outline, look at the topic areas that they discuss, and you should be preparing for each of those topics. A few things that were not on the previous content outline for the BCMTMS exam that are on there now. As you can see, you think of, epilepsy, for example, Parkinson's disease, geriatrics, pediatrics. These are vague potential things that could show up on your exam. And what I've really tried to do in our study materials is highlight some of the most important clinical pearls and things that should show up for a kind of a generalist MTM practice, because you're not going to be a transplant expert, okay? You're not going to be a pediatric expert, but you should know some basics. And what we've done with our content is really try to highlight some of the most common things that an MTM pharmacist is going to encounter. Pass rate, so this was from May of 2020, so the data is a little bit dated, and this is actually before some of those changes. So if you keep tabs on the meded101.com blog, I do try to post updates on some of these exams. So keep tabs on that. You can also check the National Board of Medication Therapy Management website. I put that link previously there, referring you to the content outline. So I'm anticipating a drop in that pass rate, looking ahead to 2021 and 2022 test results. What is nice about this exam is there are 4 testing windows. So BPS, BCPS, ambulatory care, geriatric certification. There's only 2 testing windows for that company, for that national organization. So that is a little bit of a differentiator. It gives you a little bit more flexibility with this exam. Multiple choice, the exam, all board certification exams are set up this way. And it is nice where only one answer out of 4 possible choices is correct. Okay, so that's definitely a nice thing where it's not multiple answers that you have to choose from. Okay, one of the most important things I can tell you about practicing and preparing for this exam, I just received an email a few weeks ago. They took their exam and they said they didn't finish. Okay, so 4 hours can fly by. Okay, so that's 50 questions every hour that you need to get done. So that is very, very quick. So if you're a slower reader, if it takes you longer to process information, you have got to prepare for that. The questions in our study package, I think, do a good job of giving you the approximate length of some of these questions. So you've got to prepare for that and make sure that you've practiced sitting down and taking, an official 50 questions and time yourself. See how long it takes. If it takes you over an hour, you better learn how to do questions quicker because, again, those questions will be graded whether you got to them or not. So it doesn't hurt to answer the questions. So finish that whole exam. As far as grading, it is a curved grade. So, and they base it upon the results from each year, or at least that's my best interpretation. And so you won't know, what a good percentage is, or, if you think you got 60% of the exam right or 80% of the exam right, that you don't really know for sure if that's a passing grade. But it's nice to have a target. And so what I tell folks kind of going through our practice questions, that type of thing, I feel like 75% is a good target. Okay. So I think you want to be at least scoring there to have a decent chance at passing this exam. Obviously, if you're, higher than that, 90, 95%, close to 100%, that's great. You're obviously doing better, your stuff. That's certainly a good thing, and obviously is going to help you in patient care as well. But that's kind of a ballpark figure. I would say that 75 to 80% range is where you want to target with some of our practice questions and content. Again, anecdotal. I don't have survey responses to necessarily back that up. It's difficult after the fact to get people to respond to that type of thing after they've taken their exam. But that's definitely a ballpark, I think, anecdotally, from what I've heard from a few folks. And I think it's important not to get thrown off by not knowing questions. I can remember my experiences with board certification exams. I remember not knowing, or at least not being sure of the first two questions. And, that can really rattle your confidence if you don't know, a few of the first few questions that you ask. And so I think it's important to go in with the mindset that, hey, I'm not going to know every answer on this test. That's okay. I need to keep moving. I need to not, overthink questions, particularly that I'm not sure on. Like I said, that's, I think, where people get bogged down, is you stumble into a question or two back to back, and you're not sure what the answer is, and then all of a sudden you've wasted 5-10 minutes on one or two questions, and now you have to rush through the rest of the exam to make sure you get all the questions done. So flag them, if you're not sure on them, if you want to come back to them, but make sure you get through all those questions. So studying for the exam. So I would personally set up some type of study schedule, and I would go through every topic on that content outline. I would write it down, and I would try to highlight what I'm good at and what I think I know really, really well. And I would highlight things that I absolutely don't know very well. So, in my situation, I don't deal a ton with HIV AIDS patients. So that's not something I see a lot in my more, geriatric elderly practice. So that's something I'm definitely going to focus on a little bit more as I'm preparing for this exam. Maybe you're great with anticoagulation. Maybe you're great with diabetes, lipid management. So those are areas where if you feel like you're pretty well up to date, I'm probably not going to study those areas very much. I might go through things once just to say, hey, yep, I definitely feel comfortable in this area. But I would focus my time on other areas of the content outline where maybe I haven't seen many patients, or maybe I haven't seen this disease state in a year or two or more. So definitely think about those weaknesses with regards to the pharmacotherapy topics. One of I think my best advice is really focus on medication selection. That's really where I would focus my area of studying. So, why would you pick a medication? So, like a compelling indication, is it guideline-based selection? And then on the flip side, so if you've got a question, a little, small case or something, why would you not select a medication? So, in the case of bupropion, we shouldn't be using that in a patient with seizures. And in a question asked on one of these exams, they might throw at you a patient with a seizure disorder, and they've got a newly diagnosed depression, and maybe they're looking for a medication for smoking cessation as well, and it's like, oh yeah, that's a no-brainer, we'd use bupropion. Well, you got to make sure to look at the whole case, and okay, they have that seizure disorder, and that's something you need to know, and it would be appropriate, obviously, to select something else for depression and or smoking cessation there. So very, very important, I think, to get in the mindset of that. Why would you choose a medication? Why would you not choose a medication? And I think that makes up a significant chunk of the questions and interpretations, and it requires you to know contraindications, drug interactions, adverse effect profile, those type of things, because those are all reasons why you wouldn't pick a medication. Now, the non-pharmacotherapy sections, I think of MTM, billing codes, CMRs, PMRs. What are these things? Regulatory things such as Medicare, biostatistics. That's an important topic as well that can show up. That's definitely on the content outline. You think of patient-specific factors in practice that come up, whether it's personal beliefs or religion or, barriers to adherence. Maybe it's, CNS changes, maybe it's, family dynamics, whatever the case may be, things that can come up and impact patients actually taking their medication. So these are kind of the all-encompassing non-pharmacotherapy topics. And again, there's a big, huge list on the content outline. Go through, look at some of those things. And again, obviously, we've put pretty much all those within our study materials there as well. Focus on weaknesses, I kind of alluded to that, and again, practice questions. I don't ever want to see an email come to me again saying I didn't get through all the questions on my exam, because the ones you didn't get to, you had no chance, and you don't know. They could have been the easiest questions on the exam at the end. So very, very important to make sure that you're able to keep up time and be able to get through that exam. This is the link for the National Board of Medication Therapy Management and their study materials that have been, I guess they can't technically endorse study materials, but they have listed our website as one of the providers there. I will say I am in email correspondence with them to get things updated, because we have added a ton more content than what's listed on their website currently. But I think that goes to the credibility of our content that they have listed our BCMTMS package on their website there. And of course, if any questions, you can email me as well, which I'll put in the comments below or at the end of this presentation. And there's the link to our content, med101.com/store, and just click on the BCMTMS tab, and you can see all of our most up-to-date content will be found right there. And then we've had lots of successful candidates. I'm greatly appreciative that they've actually sent emails after they've taken the exam and found out they have passed. So definitely appreciative of all those folks that have reached out. So you can hit pause and read some of those if you want to. If not, you can see some of them too at the med101.com/store link as well. After the exam, so results may take up to 3 to 4 months. So they actually say it's 4 to 6 weeks for the results after the testing window closes. So just a sample kind of spring, early summer window that they have, May 1st to June 30th. So if you take your exam May 1st, for example, you got to wait 4 to 6 weeks after that window closes. So that window doesn't close till June 30th. And of course, 4 to 6 weeks after that, you're looking into, July, August timeframe. So again, just take the exam, be happy you're done, and don't even think about the results. It's not going to do you any good. So definitely forget about it is my advice after you've taken the exam, and then get your results, and then hopefully you've passed if you've prepared well enough, that type of thing. If not, then you can start kind of developing a game plan for retaking and that type of thing. So again, I emphasize to anyone taking a board certification, retaking it it's a hit to our ego and our pride. But speaking from experience, I've heard from numerous people that have not passed their board exam the first time. I've heard from people taking NAPLEX that haven't passed it for the first time. But these exams are not like the NAPLEX in a sense that, your job likely isn't dependent upon it today. Okay? So, I think that's an important mindset, and that can help you relax a little bit, which may help your performance as well. That your job likely isn't going to depend on this today. I mean, in the future, if you want to, look and expand and, look for new jobs, that type of thing, yes, potentially. But you're going to have a pharmacist license still, right? I mean, this isn't a pharmacy license. So I think, failing it the first time is really not too big of an issue, obviously, except for, time and finances, as far as that goes. So that's a little bit of a downside to having to retake it, but I would say it's definitely not as catastrophic as, failing a law exam or the NAPLEX, which you absolutely need to be a licensed pharmacist. And then after you do pass the exam, you get certified and you get that 5-year period. And they have certain CE requirements which you can find on the website. So you need to meet those, or else you need to retake the exam. Now, my personal preference is to retake the exam. I have pharmacotherapy as well as the geriatric certification, and that's what I've done with those. If I had BCMTMS, that's the route I would go. In working, obviously, when working with others for feedback on content for the study materials, that type of thing, I would say, most are probably going to do CE. But me personally, with 2 certifications, it just gets overwhelming and honestly a big headache to keep track of all the CE as well as state requirements that I have, because I'm a licensed pharmacist in 3 states. So I've just kind of thrown that off my radar, and I just go retake the exam, which honestly I think helps me prepare better and stay sharper as a practicing part-time pharmacist. So that's my preferred route, but obviously to each their own. Some like to do the CE and just have that assurance that they don't have to take the exam again either. So that's kind of the breakdown of how long that credential lasts, and then what you need to do to keep it up. So you can track me down if you've got questions. Hopefully this provided you a good summary of the exam and kind of why board certification is growing in popularity, and definitely what I foresee in the next 5, 10, 20 years of pharmacy. It's going to play a significant role in what we do, what we're allowed to do, and hopefully more and more with what we can bill as that has expanded, certainly at least at the state levels for sure. So LinkedIn, feel free to connect with me there. And then mededucation101@gmail.com. And then obviously meded101.com is my blog. You can go check that out. And if you're looking for free resources, I do some educational blog posts there, as well as reallifepharmacology.com too. I've got a podcast there that I do a drug once a week and break it down and provide some clinical pearls as well as just general pharmacology. So if you're looking for a little free audio review on various drugs and topics and type of thing, you can go check that out. So I thank you so much for listening. If you have a comment or suggestion below on other topics you'd like to hear about, I definitely put content together from time to time and release it on YouTube, so feel free to leave a comment below with a suggestion or that type of thing. But if you're going to send me a question, probably the quickest response you're going to get is my Gmail account or potentially LinkedIn there as well. So thank you so much for listening. Hope this helps somebody out there, and best wishes if you're pursuing the BCMTMS certification.